Now to For Your Health and a new twist that can help prevent miscarriages. Now this new test can help couples get pregnant and complete a successful pregnancy. And it's being done right here in Southern California. To tell us all about it now, our own Dr. Bruce Hensel. Bruce?
Oh, Chuck, a lot of people don't realize this. The number one reason for miscarriages, chromosomal abnormalities. Now, up till now, we tested 5 chromosomes. That missed a lot of potential miscarriages. But now we can test all 22 chromosomes. That's what this test is about. We followed a local couple as they went through the testing.
How are you, doctor? Nice to see you, too.
This is a big moment for Marva Milano and her fiancé, Hassan. They're about to find out whether they can start having kids right away.
I'm going to be 43 next month, and I've been in school and working, and all of a sudden, where did the time go?
So far, they've had many tries and many heartaches.
It's very emotionally straining. You're already dealing with a financial investment and heartbreak, so it's not something that you want to keep repeating.
Now they're trying a brand new method of fertility testing called CGH testing in hopes of getting better results. Through this method, doctors do comprehensive genetic testing on the embryos before they get implanted.
So this new technology allows us to test all the chromosomes. When you transfer chromosomally normal embryos, the implantation rate is much higher. The pregnancy rate is much higher, and the risk for miscarriage is much lower.
Here's how it's done, as seen on one of Marva and Hassan's embryos under the microscope. Using laser technology, the doctor makes an opening in the embryo and takes a cell out to test it.
It's about 29 hours for us to analyze the DNA and determine whether that embryo is genetically normal or not. When we transfer 2 high-quality embryos that are chromosomally normal, we're averaging over 83% chance at a pregnancy. Now, if you look at these embryos,
It was time for Marva and Hassan to see their results. Out of 8 embryos that looked normal under the microscope, the testing showed only 2 of the embryos were genetically normal.
Genetically, there was 1 boy and 1 girl that came back as normal. And I'm happier to know that I did not transfer abnormal embryos and then had to sit back and wait to see what becomes of it. The most likely outcome would have been a miscarriage.
I'm glad we did this test. Yeah. I think this is a great technology to try to minimize, more disappointment, more heartache, and just try to get, right to the result you're looking for.
Another advantage, faster test results. As you heard, up 29 hours in some cases. That may allow us to do an embryo transfer sooner, increasing the chances for a normal pregnancy. Colleen?